So a recent study found up to 82% of COVID-19 patients in the hospital experience neurological symptoms. Those symptoms include mild issues like headaches or loss of taste to much more serious symptoms like stroke. So let's find out about the virus's impact on the brain. Dr. Karen Olds is a board-certified neurologist and medical director for the stroke program at St. Luke's Marion Block Neuroscience Institute. Dr. Olds, thank you so much for joining us this midday.
Thank you for having me.
So we just talked about some of the neurological symptoms COVID-19 can cause. How is this virus affecting the brain? What's happening?
That's a great question. They've not been really able to isolate the virus in the brain consistently or in the cerebral spinal fluid that bathes the brain. But occasionally we'll see neurologic manifestations that are more on the serious side, but they seem to be more along the lines of a systemic inflammatory response with multiple organs affected and clotting and such in blood vessels, not just to the brain, but clotting in dialysis catheters, folks that have pretty severe illness. We haven't seen a lot of that at St. Luke's in regards to strokes in young people, but that's what has kind of caused this scare about the COVID and the neurologic manifestations. You mentioned 80%, and those are along the lines of the less serious, perhaps, neurologic manifestations.
I know some of the patients that I've interviewed that have survived COVID-19 in their home, they talk about memory issues, and some studies have linked COVID-19 to strokes in people as young as 30 years old. So what's going on with the memory problem? Is that going to be long-term? And what's causing these strokes in such young people?
In regards to the memory problems, I think some of those older folks, it's the same as it would be with any really severe infectious disease where folks are perhaps in the hospital for quite some time and develop delirium or encephalopathy, and just takes them a while to get back to how they were previously if they're able to, survive the COVID infection. The strokes is a different entity entirely, and we're not seeing a big increase in strokes. It was reported early on a case series of 7 patients in the probably 30 to 45 age group in a New York hospital, and perhaps that was a little bit of a fluke, but it does seem to, in some people, have a really robust inflammatory response where folks can have clotting disorders, including strokes and heart attacks and things like that, but it's not very common with this.
So we have to talk about treatment. Kind of give us the lay of the land. How many patients with COVID-19 at St. Luke's the neurological team is dealing with? Do you deal with all of the patients? Do you just kind of assume that there's a neurological impact and you're treating them? And what are you doing for them? What can you do?
Well, there's all sorts of different protocols, infectious disease-wise, to treat the COVID patients, and convalescent plasma, and all of those things are being utilized at St. Luke's, and the antiviral medications that we hear about. We're not really involved on the neurologic side of the majority of the COVID patients. Folks that have been very sick and on the ventilator for an extended amount of time, they're debilitated and not able to move around and perhaps taking a while to wake up. Many of the folks that end up with severe COVID infections on a ventilator require sedation for an extended amount of time to help them tolerate the tube and having being placed on a ventilator. So we do get consulted. That's probably the most common consult we get, is folks that are having trouble waking up after severe infection, but they have multiple organs involved, not just the brain.
Dr. Karen Olds with St. Luke's, thank you so much for joining us. Appreciate the help.
Thank you.